little bit.
The clack, clack, clack.
Yeah, a little bit.
I can hear the keyboard. Yeah.
Am I loud enough?
And yes, Dr. Rentas, this is Aaas. He's he was the creator of the community. Candace and I came aboard a couple months after, but he's the original mastermind.
Wonderful.
Yeah.
Nice to meet you.
He's
Nice to
in
meet you,
India
Dr.
right
Rentas.
now in the lab
Yeah.
working on a Sunday because apparently he hates himself.
I love that.
I hope you have fun here.
Thank you. It's my pleasure to be here.
Can see we're starting to get a few people in. And let me see on YouTube, what do we have? Oops. Okay, wonderful. Okay, I think we can get started regardless of, and then people will start to join. I don't want to get started later because I want to be mindful of the times and stuff. Hi guys, welcome. Today is the third and last day of the conference and we're kicking off with our first event, Dr. Carol Rentas. She is an assistant professor at the Biomedical Laboratory Sciences Department of the George Washington University. Dr. Rentas has worked across the country as a medical laboratory professional in military and civilian institutions before she made the move into the more educational field with about 20 years of experience on both. Her major interests include knowledge interpretation and dissemination, implicit bias in education, and innovative educational technologies. Without further ado, I hand it off to you, Dr. Rentas.
Thank you, and welcome to whatever time zone you are in right now, whether it's morning or afternoon. It's my pleasure to be here to talk about a subject that I think is really important to not only the future of any country that you reside in, but to the world community. And that is, today we're going to talk about how scientific findings are relayed to the public and the possible impacts of that. And so today, my talk is entitled Scientific Findings, a Cloud of Suspicion and the Public's Perception, because how we communicate, when we communicate, and even if we communicate, is really important to the future of science and its impact on so many aspects of our lives. So as we move through this, I'd like you to think about some of the following questions before we get into it. What % of Americans can pass a basic science literacy test? This is really important when we're talking about communicating science. Have you had to explain any science or medical information to the public, either in an individual or group setting? Many scientists have not, so let's talk about why that might be and what we can do about that. And then in your mind, briefly describe any types of public engagements or outreaches that you might have participated in, and then think about how you might do more so in the future. So today we're going to talk about the contrasting natures of scientific discovery and public opinion. We're going to explain contributing factors leading to the evolution of the public's skepticism. And what I mean by that is we're not doing something right based on the current events and the events of the last couple of years. How we communicate science is not being portrayed as we would in the scientific and applied scientific community like that to happen. And then we're going to talk about demonstrating the importance of effective communication of science to the public. How do we do that and why is it important? And then what tools could any scientists use or any applied scientists use to relay findings to an average citizen? Okay, so what is the public's perception of science and scientific research? So first of all, let's talk about what we mean by the public, because there's a lot of different groups and target audiences out there for the information that we have. We really want to define what we mean by the public. And that's any citizen of a state, nation, or municipality. And it's often used as a relative term, right? We could talk about the world community at large, and that being the public. So as I asked those questions before, I brought up questions on, what is the public? And now that we're talking about that, the question of how many Americans can pass a basic science literacy test, only a little bit more than a quarter. So that's something to keep in mind. Also keep in mind that 50% of American voters do not even have a college degree. So some of the basic knowledge that might help understand science is not going to necessarily be there. And then about a quarter of Americans said last June that the pandemic was planned by powerful people. So think about that in the disconnect there in what is the reality of the science, in this case, the pandemic, and what at least a quarter of Americans are thinking about what caused that. All right, so let's look at the perspective of the public in regard to certain areas of science. So 28% of the US public say it's safe to eat food grown with pesticides, where more than 68% say it's safe. So you can see there's a discrepancy there. 52% of the public favor offshore drilling, where only 32% of the science. So you can see that it's not always in the way you would think it. In the case, because of environmental issues and environmental problems, scientists realize that offshore drilling might not be the best option. But you have to think about the other competing factors that the public considers. 64% of the US public agree that the International Space Station was a good investment, whereas 68% of scientists do. So you can see that that's closer to an area of agreement. So thinking about this, if there is this disconnect, as we can see by some of these survey questions, then why bother? We haven't really made it a part of our scientific agenda to worry about what the public thinks. And so Jane Lubchenco, who is a past AAAS president and who has dealt a lot with these issues, said, I quote her in saying, "We must engage more vigorously with society, but we cannot do so from lofty perches above society. We must be more integrated." And so that's what I would offer to you today. It's not a matter of just preaching the science. It's a matter of knowing who your audience is and really who holds the future of science and how it can be applied in their hands. So it's really important that we become intimately familiar with what are the thoughts of the public and get their feedback in addition to providing them with some information. Okay, so where might the disconnect come from? Well, really, how we communicate science as researchers and as practitioners is very different on how the public processes information. So as you know, when we start out in science, we first look at a background, what's out there, what questions have been answered, and then what questions need to be answered. Then we look for supporting details, and then we come up with a result or conclusion. Well, it's completely the opposite from the public's point of view. They want to know what the bottom line is first. So they're starting from the bottom. What are the results? What are the conclusions? And then how do they matter? So what? How do those conclusions or those results matter? And then finally, then tell me what details I need. Then you can kind of shore up your argument with details. So they're really working in the opposite fashion. And so we have to learn to flip that narrative when we're talking with the public. I think it's important to get some perspective, more public perspective. And the Pew Group did a survey of the public and determined kind of the nature of the differences between science and scientists and the public. And so you'll be able to see from some of this data that some public divides over science issues are not always partisan. We tend to think of them as partisan in the current environment. But if you look at this data here, and I will make this available later, that Americans with more education and family income say the measles vaccine's benefits are high and risks are low. And so it's really a dynamic of not partisan divide, but socioeconomic divide on what the leanings are as far as agreement with science. Different public views about some emerging science technologies. So you'll see that emerging science and technology often elicit very mixed reactions in different groups. So you'll see here, you can see the use of medical technology. It seems to be appropriate, right? But then when you get to automation, depending on how that affects jobs and livelihoods, it can really be different in different groups. Most see net benefits from science, so that's encouraging. If you look at the data, most Americans say science has a positive impact on society. So we have to leverage that, but be very cognizant of groups that may have a more distrust of science in general. For instance, the African American population, based on historical abuse in the field of science, would have more distrust. And we're seeing that play out with the vaccine, certainly. Public confidence in scientists has actually increased. So that's good news. You can see that over time that the idea that scientists are acting in the public interest has actually gone up. Public opinion difference over science experts in policy matters. So we don't have a lot of time to cover this in this talk today, but in future talks I'm giving, I'm addressing how to affect policy based on science communication. And so this really differs based on the area that you're talking about. 6 in 10 in the US say scientists should take a more active role in policy debates. And that's something we don't like to do, right? But it's going to be really important for the future of science, and therefore its application if we don't. And then you can see there is a political divide on whether policy, more Democrats than Republicans, I should say scientific experts make better science-related policy decisions. So you've seen this play out in the last couple of years. Facts alone do not explain public confidence in the scientific method. So you can see once again a political divide on confidence in the scientific method. Trust in practitioners is stronger than for researchers, but science skepticism is still widespread. So you'll see that we do have, as far as practitioners, trust in medical doctors and dietitians is higher than for researchers in these areas. So while, and this is something maybe to capitalize on if you're a researcher, while the public has great faith in applied science, and that would be, medical practitioners, engineers, but have less faith in the research that generates that practice, I should say. And then finally, what boosts public trust in scientific research findings, because that's where the real disconnect seems to be now, is most say it's making the data more openly available. So most Americans say that if the data is more openly available, then they would be able to understand it and trust it more. So you're going to see then this kind of understanding from scientists that they're first of all, afraid to give the public information, overwhelmed, don't think that the public can consume it appropriately, don't have the time to do so. Perhaps in their minds, they think they don't have the time to communicate with the public. And so, but the public is asking for it. So what happens in many cases, then we leave it to other entities to explain the science. And we are the ones that really understand the details. So you can see then, so what's the good news? So if you look at the scientific community, we have pretty much maintained a public trust. You can see here 40%. So we should look to increase that, and we have somewhat. As compared to the military, the military in the past, especially with the Vietnam War, had less public trust. But then that has steadily increased. But as far as compared to education, the press, and Congress, we do have a solid foundation for public trust at 40%. Now we just need to take that farther and use that to educate the public. And so trust requires 4 pillars, really. We have to show competency in what we're providing. We have to show a reliance and consistency in data. We have to make it believable, a credence in what we're bringing across. And we always have to have show integrity and consistency in the information. So here is just a kind of a neat little diagram. It really shows public trust on important issues. And in general, you can see scientists have 4 out of 5 stars, which is encouraging as compared to some of the other groups. So, you know, we do have a solid foundation to work from. You can see trust is very dependent, though, on how it aligns with the public's values and different groups and their values and interests, I should say. And so you can see here the flu pandemic, and certainly you can put somewhere in here the pandemic. This was pre-pandemic information. All right, so you know, a study and point, it would be the past couple of years, the pandemic, right? And how the public views science has definitely had a political bent to it. And so you can see here, the founder and director of the Scripps Research Translational Institute, Eric Topol, said, if you were to write a script about how to destroy the credibility of science, we just saw it. Just based on how politics affects the messaging of science. So, you know, people are quite capable of viewing scientists as lousy experts when it comes to specific issues that don't fit their notions of what's true. And so I put this in here because perhaps the Aaas and several other organizations that I'm going to mention have been shouting from the rooftops to the science community for more than 10 years now about the need to communicate public to the science. This came with, you know, the disconnect between religion and science in regard to the education of evolution. About 20 years ago, I started to get involved with this with Aaas. And so you can see then that perhaps the pandemic has brought it to a head in that issues that are important to the welfare of every average citizen is being affected, and the science that will provide solutions is being affected by some of these forces, because science is either not able or decides not to be responsible for the education of its findings. Okay. So what is the effective science? Why is science communication important? Effective science communication. Well, communicating science to the public is important for several reasons. I've just listed a few here for us to go over. But first of all, We want to have the scientists interact with the public and share the science so that they can demonstrate that they are people just like the public, that although they are scientists, that they share some of the same community values. And so they want to get the public interested then in those science related issues. To do that, they need to hear what the public is saying and thinking about science related issues. And I personally think this is a huge key to being able to provide education in this area. If you don't understand where your target audience is, you can't possibly educate them. Also, the reason why it's important is to frame implications of scientific research so that the public can consider how science resonates with their values. So if you understand what their values are and you share those values, then you can indicate or hypothesize, give them options as to why it's important for them. It does, when you interact with the community and you educate them, it does exhibit the scientific community's expertise in this area. We have to explain why we believe these things to be facts. And so it does definitely help to exhibit, expertise, which will make the science more credible. It also shows the scientific community itself does care about the society's welfare. We're not just in our ivory tower, just, cranking out this information for a Nobel Prize, right? It's not just a competition of minds. It's really designed to provide solutions to the public. And then it also does ensure that the public is well informed about scientific issues. Why is that important? Well, the public does in the form of government and other institutions fund science. So ultimately, they are the caretakers of science indirectly. And so they really have to know what they're supporting. Otherwise, they won't support it at all. Okay, so who is responsible for communicating science to the public? Many scientists would like to say it's not their responsibility, but I would submit to you that it is our responsibility. If we look at the flow of scientific information, you'll see that currently most of science research and what a scientific researcher provides as far as information gets filtered through media and policymakers and then makes it to the public. So it starts out, when you think about it, considerations for things like the complexity and situational specificity of science and the statistical implications that the public doesn't really understand, right? Risk and correlation aren't really part of the public vocabulary, right? And so this actually gets passed along to media and policymakers that have to distill this information into usable sound bites, right? They have to start out with a title to hook their public. It has to be marketable, so sometimes they use shock value and kind of tweak the information such that it really may not be what we would want the public to for public consumption, right? They revise it. And then so finally it gets to the public, and what do they care about? Well, they just want to know the effects on public welfare. They want to know if these things coincide with their values, and they want to know, how it's coming across as far as any political bias and alignment. So all of these issues are things that they're considering as they're consuming it. And when it goes through this intermediary filter, we might not be getting the message that we intend to get to the public, considering all these other issues along the way. And so how can we take responsibility for this process of communicating science to the public? Well, we're not going to cut out the middleman always, but what we can do is in large part communicate directly with the public. We can make sure the information is there that we want once we have considered all of the issues in the public arena. So this is not something that the AAAS is necessarily advocating, but this is something that I would suggest we think about, and that is maybe automatically include a research component of canvassing public opinion. So perhaps before a journal article is published, that there is some sort of canvas of public opinion, not the scientific community, but public opinion, so that some of those issues can be asked of the research community. Maybe to incorporate public education as a final step of the research project after or alongside peer review and publication. Perhaps a short article in a newsletter, a public newsletter from AAAS for every article they publish, so that the researcher has to describe their research in terms that is consumable for the public. And then finally, why we're here today is training each and every scientist on public engagement and education, because without that, they really can't hope to do what is above. And so what I suggest here is more of working at the level of publication. But today we're going to talk about and ask that scientists will actually reach out directly to the public. Okay, so what is technically public engagement in science? So most of this can be found, and I would suggest that many of you will give you the resource, look to AAAS and other resources, which I'll provide to get training in public engagement with science. There's actually master's graduate programs out there and certificates in this art of practice of public engagement with science. But as far as the AAAS, they'll define public engagement with science as intentional, meaningful interactions that provide opportunities for mutual learning between scientists and members of the public. So that requires 4 facets. It requires a multi-directional dialogue. As I said before, we can't just craft a lesson on some of the research that that's being done and then just put it out to the public. We have to understand where they're coming from and how this research fits into their community. The public engagement must address the benefits of science. So you got to kind of sell it, right? Why bother? It's not just doing science for science sake anymore. Science is too expensive for that. So what benefit comes of the science for the public? The engagement must respond to issues and concerns of the public. How not only how might benefit, but what are the possible risks of the science? And that needs to be vetted with the public. And finally, listening to and respecting the public's viewpoint is really key to any form of communication, especially when it's so important, such as this. So how can scientists effectively communicate with the public? Well, actor and author, activist Alan Alda has had a lifelong passion for science. And that started when he was asked to host a PBS special on a Scientific American Frontiers. And on the show, he used his improvisational theater training to help the scientists that he was interviewing to relate to him. So in talking with him, the scientists would explain their work in ways that originally Alda couldn't understand. And so he used his skill to try to lead them in a direction so that the information would be more understandable. So Alda at the time built personal connections with the scientific community. And about 11 years after the show, Alda kind of struggled saw the struggle between the scientists in moving from lectures, trying to lecture about their work, to just talking about their science. So what he thought, what he was doing on his show, he thought he would build a center for communicating science, which is there at Stony Brook University since 2009. And at this center, he uses improvisational exercises to work with the scientists and the community to help them to craft ways to present their information to the public. So his quote is here, which I love. If scientists could communicate more in their own voices, in a familiar tone, meaning how they talk to their families and their loved ones, with a less specialized vocabulary, would a range of people understand them better? Would their work be better understood by the general public, policymakers, funders, and even in some cases, other scientists? Because as scientists, we are consumers of the work of others, and often the language that we're using is specific to that area of practice. So, he was brilliant in his understanding of this process. Okay, so let's talk about, and this is information from Aaas, the steps of public engagement. And once again, I'd invite you, if you have a deep interest in this, to look at the workshops that Aaas has. So if you look at this wheel, you can see it goes from a planning to an implementation to evaluation stage. And this is very much, for those of us that teach, very much a curricular sequence, right? So you first have to plan your public engagement, build a goal, because there's many kinds of public engagement and many questions or topics that you can engage the public with. You have to understand who your audience is, pick an audience, and then you have to formulate your message. Then you have your engagement, but just as important after the engagement is getting the feedback from the public, any self-reflection on how you might change that, and any formal evaluations could be in the form of surveys. So let's talk about these quickly. So planning your goals. You got to think through your goals for public engagement and look at the big picture, your long-term, and then your individual short-term goals. What do you want to do with this public engagement, right? And we're all probably familiar with the SMART goals. So be specific, make sure it's measurable, attainable, realistic, relevant, and time-based. An example of a goal would be if you're looking at to limit disease spread. There's the big picture of limiting the spread of disease, but who is your target audience? So think of the goal for that. And you might talk with your child's class so that they'll use the correct hand washing method. So you have to ask yourself questions when you're building your goal. Why are you engaging with the public? What's your reasons? What do you hope happens after your engagement, either short-term or long-term? And what step can you make in that direction? So the next part of the planning is, who do you want to engage? Be specific. Think about what their interests, values, concerns, or needs. You might interview a couple of people in this area to see what their understandings, what commonalities do you have with the audience that you can capitalize on to relate with them and to them. What questions might the audience ask? And then do you need to adjust your goals that you formulated? So audience for engagement, there's many audiences for engagement, so many groups that we need to address, public groups that we need to address in regards to science issues. The media would be one, and using the media would be one. Aaas has a workshop on using media as a form of communication to the public. Decision makers, policy makers, public for health initiatives, faith-based communities, and public health risks, right? So all of those are important audiences. To get to know your audience, you can look at predictors that might influence people's views on scientific topics. So these might be areas you might consider when you're thinking about an audience. Political party, unfortunately, is one of them. Who are you going to be addressing? Because you might have to address particular questions depending on who you're talking to. Age, religion, certainly. Background, as far as what education and science knowledge do they have. Gender may be a consideration, and ethnicity. So all of those and the culture that audience brings with it are important to consider on how science impacts those areas and how you're going to address those concerns. Okay, so now the messaging, and this is really the fun part. So developing a message in advance helps you be concise. Remember, they want to get the sound bites. They want you to start with what's the bottom line, right? So you need to practice concision, which is not something, and it's not a strength in science at all for scientists. Encourage conversation. Your message should encourage conversation with them. It shouldn't just be a one-way message. And anticipate questions. So your message, in developing your message, you're going to do all of these things. It also helps your audience connect with you by doing that, by developing a message with these considerations. Pay attention and remember you, because they're going to remember the information as it connects and relates to you. Very humanistic approach. So the 3 M's of an effective message, keep this in mind when you're making your message, is make it small, miniature, memorable, and meaningful. Make it easy to remember, serve as a simple outline, be concise and expandable. So, what are data points, findings, solutions, facts, and questions? And notice solutions is bigger here, right? Because that's what they want you to emphasize. When you're thinking about 3 things, make sure that it's easy to remember. So stick with the rule of 3 in your message. 3 bullet points of your basic message. Use alliteration, rhymes, analogies, props, stories, and pop culture to help it be memorable. As you might know, alliteration is the use of the same beginning consonant sound in a line or verse. So make sure that it's meaningful, that it provides a shared connection, that it shows human experience using the audience language and as little scientific jargon as possible. And so this is an example of the rock cycle using food in order to make it memorable and understandable for the public. Okay, so what is jargon? This is one of our major problems. It's specialized language in a field, right? And used in any other context except in that specialized field is not going to be well understood, okay? So, and some people don't consider acronyms. We use them so quickly and easily that they're not going to be understood or memorable, right? Also, something to consider is often terms will have a public meaning, but different than the scientific meaning. Theory is a great example. When I say in the public realm that I have a theory, it means I have a guess. But when we talk about theory in terms of science, it's well substantiated evidence that comes to a certain conclusion. So you really have to understand where the public is coming from when you use certain terms. Okay, so the message structure on these engagement messages, make sure you give the big picture and the importance, the 3 key points you want them to remember, minimal detail on those key points, no unnecessary jargon, and keep it clear, streamlined structure. So how do you translate detailed and complex material into a clear, streamlined structure? Just think about, why should they care? What is the big picture? And what are 3 things you want your audience to remember and respond to? And use it in language that can be that's short and can be remembered quickly. Think about selling it. If you were just selling it, how does it sound? Sort of like a jingle, right? So then implementing it. So there's 5 types of public engagement: everyday engagement, public dialogue, policy deliberation, knowledge co-production, and university-led cooperative engagement. And these are, once again, this is the literature from AAAS that is telling us, what are some areas of engagement that we could consider. And then finally, you're going to evaluate your audience feedback, right? You're going to provide formal evaluations so that you can understand how the impact of your outreach. And then finally, self-reflection. So let's start with the audience feedback. While you have a captive audience, encourage questions and listen to their questions, and provide feedback to those questions, but perhaps ask them questions and look for body cues. How are they responding to the information you're giving them? Because that can really signal on how they're absorbing the information. You might do also formal evaluations like surveys, email follow-ups, audience Q&A, and determining whether legislation was passed based on the information that you're putting out there. That would be a formal evaluation of success of an impact, right? And then self-reflection. You could kind of tell by these other 2 evaluation styles, audience feedback and formal evaluations, how it went. What went well, right? What should I change? Did you find yourself struggling to get the message across, and how could you change that? Were the goals met that you had originally formulated for this messaging? And was the message effective in the end? Okay, so that's basically in a nutshell instances in which you could, or tools you could use to communicate with the public and message with the public. But what are some resources if you want to take this further? And I would strongly recommend, if you're interested in this, to look into the resources at the AAAS Center for Public Engagement with Science and Technology. The AAAS as the the Association for the American Advancement for Science, and they recognize that you can't advance science without communicating science to the public. And so they have, I just put this here, you can see it on their website, but this just looks at the kind of the map of outcomes in regard to outreach of science to the public. But I'll just go over some of their communication outcomes that they want realized in this area. So communication outcome 1, for the short term, what they hope to do from helping scientists to engage with the public is to humanize scientists, make them relatable to the public. Because long ago, they recognized that often when a scientist speaks, people often don't listen, whether it is they think of them as something other than, they don't deal with them on their daily lives. They don't realize they go home and they have problems. And so by scientists talking with the public as a public citizen, it makes them more relatable, which is important in order for the public to accept any messaging that is put out by scientists. And then the medium and long-term goals are really just building a trust between scientists and the public. The communication outcome 2 that the AAAS has is to increase scientists' public engagement identity. So we want scientists to be the ones that people go to for the information. We want we want the public to trust that they can understand what the scientists are saying. We want the scientists relatable, such that the information seems like scientists have the same needs and values that many in the public do. And so in the short term, the AAAS hopes that there's an increased public engagement identity, that the public will go first and foremost to the scientific community. Medium range goal would be to build scientist skills in public engagement and relationships between scientists and the public. So what this means is that many scientists, if not most, many do not have the skills to engage with the public. And so I hope with this, it also is the encouragement of scientists to do it more, not just to build this skill in a few. And then finally, the long-term common public engagement, because it becomes embedded as a part of the scientific process. So want it embedded as part of the scientific process. And as I suggested, in the scientific community, we can think of ways to do this, to kind of force science communication with the public as part of our everyday scientific process. Maybe, each and every scientist has to have a public engagement with each research article that they publish. Communication outcome 3, increase interest and motivation for public outreach in the scientific community, increase willingness to consider the science-society intersections. And this is also a problem in the scientific community. We just are nose to the lab bench and don't consider the implications, and it's important that we do. And then be attentive to other views about science. Give the public a seat at the table. That's going to be key, and that's probably the hardest thing. We need to give the public a seat at the table. They are going to be the consumers of the science, and ultimately, they are actually going to be the one that says yay or nay, because they are the voters. So it's really key and important that we include them. So this is the public outreach vision. I won't go through, I'll just kind of talk about this in general, but basically the vision is that science and science communication to the public becomes so embedded in public discourse that it can influence, educate the public so that they are more comfortable with the science, and that will then influence how science is practiced in daily life. So, and also they hope that it will actually have an effect and bring more people to science than would have previously come. So I just have 2 quick examples here of a message that was built. This is an example in translational research. And as you know, translational science research brings the basic science research to the community to practice in some way. And so in this case, the person that was building a message on fungal infections, and they wanted to emphasize the importance of basic research to get support for funding. So that was their goal. And so their audience was the Utah Public Radio journalist and her listeners. And really her message had these 3 points. There is possible new antifungal medication, fungal diseases are deadly, and basic research funding is critical. So basically they would start with these 3 messages and repeat those over and over again in their conversations with on this radio talk, this public radio show. And here's an example in medical science. So direct access testing is where now patients can actually order their tests directly without getting the order from a clinician. And so for medical laboratory science, that has implications on who is going to be consuming the lab test results. So, and patients often don't have the background to understand this. So the goal in this case for this message was to help patients understand ordering and interpreting the direct access testing lab results. And the audience was patients who might order the direct access testing without the direction of a clinician. There is a site that's being built there's a site in one scientific community, the American Association for Clinical Chemistry, where patients can go on there and get information, and some other educational sites that are kind of using this messaging. And so the miniature message is access, assess, and advocate. So you would tell them first you should access. So the DAT testing is accessible. And so to the public without a doctor's order, where do you go for good information? And how do you protect your privacy? So that would be telling the patients to access it. Assessing that information, how do you assess the lab information to use it correctly and efficiently? And then advocate or act on your own behalf. How can you use this information to work with your clinician and use it to advocate for your health on your own terms? So this is educating the public in this way. The engagement was a short demonstration of ordering, going over reference ranges and sample results, and providing some results and work through what they mean in this engagement with the public. And then after the engagement, we interviewed participants to see if they have any follow-up questions, and can go through the process of access, assess, and advocate themselves. So that was an example of a message. So as we conclude this talk, I'd like you to consider the following moving forward. What challenges have you encountered, or do you anticipate when trying to communicate difficult concepts with a non-science member of the public? What areas of science do you think needs to be focused on in the area of public engagement? And what methods will you use to communicate effectively with the public in these areas? And so some resources that I'd like to suggest for you to go to is certainly go to the AAAS website and look for why public engagement matters. There's all kinds of workshops there and information on how to engage the public. The Alan Alda Center for Communicating Science at Stony Brook University, they have modules, free modules online for you to look at. They also have academic programs that you can enroll in order to get some expertise on how to communicate at a very deep level with the non-science community. And then ESCI, SC, and that's a nonprofit organization that empowers scientists and helps them to communicate with the public, and they have some resources there. So I would invite you to think about areas that you can engage as a scientist with the public. It's sorely needed, and then also work with the scientific community on ensuring that this becomes just a normal part of our practices. And that concludes my talk for today. As far as this talk goes, do we have room for questions, or how does that work?
Yeah, we're running a little bit short on time. We do have another talk coming up in about 10 minutes, but we do have an assortment of really wonderful questions that were sent in from Discord and from the viewers on YouTube. I don't think we're going to have time to cover them all, but I think we can definitely hit at least one or two. Let's see here. It says somebody had a concern that I thought was really important to bring forward. The user says, a few things I have found challenging communicating my own research to the public. Having to sell often leads to people being disingenuous to what the research can actually achieve can be used for. It is hard to explain why I need 5 years to make incremental advances. And the answers are usually, you're so slow, why should we fund you? Any advice on how to tackle these types of issues?
Yes, so I would say, first of all, I think that consider their viewpoint and consider how you could answer that in a way that would explain the risk for moving too quickly with examples. I would invite anyone here, and I'm not trying to sell AAAS, Alan Alda Center, or SC at all, but they will work with you on these very questions on an individual basis. So if you take a workshop, you can bring your questions and your agenda as far as what you want to communicate with the public to some of these specific questions that might be asked that we don't have time to talk about today. But I would say with that particular one is trying to find a simple way to explain, maybe in a diagram, what are the benefits for that long-term trek. And even in terms of money or in terms of risk, I think really the public can relate to and respond to. So I hope that answers the question.
Sorry, I was muted. Yes, that is a wonderful, wonderful answer. Thank you so much. Just one more question, and before we wrap it up, what would you tell to all those scientists that say that SciComm is not important and that it is impossible, incorrect to simplify concepts to make them understandable to lay people that are starting learning the very basics of a subject?
So I would say I find that very interesting because working in the area of education, where you look at different target audiences, you definitely have to provide information at a level and with language. Just as if you went to another country, you can't speak in your own language or you won't be able to communicate ideas to somebody else. So it's a similar thing that, yes, we're coming from a different perspective. And I'd rather have us as experts be mindful of how we're crafting that, what we're considering more simplified language, but in some ways more complex, because if you're distilling something to the important areas, that's where we should be able to excel in ultimately if we hone this craft. And so I think that, so why should we bother to do it? Well, quite frankly, the pandemic was a perfect example of this, because we won't be able to practice our science and or have our science applied as we would want it to be applied if we don't do it. So once again, I do suggest that you go to some of these workshops if you feel that if you don't understand the implications of why we need to do this, or if you don't know or are not comfortable on how to do this, because really it's just another skill. You know, we're comfortable in how to do science and communicate science to our peers, but it's just another skill that we can learn, and it's probably just as important, if not more so, because science can come to a standstill, and if the voters don't agree with what we're doing. So I think it's really key to the future of science and our practice also that we do that.
That is such a truthful and wonderful answer. Thank you. I think we have time for like one last quick question. How can we, the viewers, who are mostly budding scientists, help contribute to increasing science trust and awareness?
So I would say getting involved with some of these groups that are communicating, even if it's just at a local high school, talking about, as a budding scientist, talking about science in general. So starting those, practicing communication with science and how it's important in general will really serve as a model to some scientists that have been practicing for a while. So actually, in many ways, you can pave the path for what science can look like and its interactivity with the public for the future. So you can make a great impact for all of science in doing so.
Sounds great. Thank you so much, Dr. Rentas, again for joining us. I'm briefly looking over the Discord chat, and people have been basically praising after your words.
Oh,
Some of your phrases have stuck through, and I do think that this does make a huge difference in making science accessible, which is what we want to do in our community, basically. Thank you so much for joining us today. It was very enjoyable.
thank you. And all of you go out and communicate with science, but go to these resources and start this ball rolling forward. You all take care.
Thank you.
Have a wonderful rest of the conference.
You as well.